Hello and welcome to another ICS Impulse video. I'm Wendy Crumley-Welsh, the product manager for ICS Impulse, and today we're going to be talking about repositioning treatments or repositioning positions for BPPV. Repositioning provides the ability to treat BPPV or benign paroxysmal positional vertigo. The purpose of this treatment is to relocate the otoconia which have become dislodged and are in the semicircular canals near the cupula, which is called canal lithiasis, or attached to the cupula, which is cupulolithiasis. Now note that cupulolithiasis is much rarer, and in the literature some people have reported that only about 5% of patients with BPPV actually have cupulolithiasis. The majority have canal lithiasis. The otoconia are being moved back into the utricle where they originated by changing the patient's body orientation with respect to gravity, and thus treating the BPPV. Different positional tests are used to treat anterior-posterior canal BPPV or lateral canal BPPV. And note that posterior canal BPPV is the most common BPPV. One thing to note, that research literature has also recommended that if the patient does have cupulolithiasis, that vibration be used in combination with the treatments, and that this is more beneficial. So we're going to be talking about several repositioning maneuvers. The first one is canalith repositioning treatment, or sometimes called CRP, canalith repositioning procedure. Most of these treatments also have a proper name, or the name of the researcher who contributed to the development of this maneuver, and this one is often called the Epley maneuver. So this treats anterior posterior canal BPPV, and then we record the patient's eye movement during the maneuver. The patient is sitting. Just like Dix-Hallpike, the head is turned 45 degrees to the left or the right, depending on which side is being treated. The patient is laid back with the head slightly hanging off the end of the exam table. Then the head is turned 90 degrees in the opposite direction. Continue in the same direction and turn the head an additional 90 degrees. It is best to continue recording the eye movement until nystagmus subsides. So that means you don't move a patient from one position to another position until the nystagmus has subsided. And what's very nice about the software is this gives you a real-time SPV so that you can monitor that nystagmus. And then at the end, the patient is brought back up to the sitting position, and again, the eye movement should be recorded until nystagmus subsides. The next repositioning maneuver is liberatory. This is often called a Samant maneuver as well. This treats the anterior and posterior semicircular canals by recording the patient's eye movement during the maneuver. The patient is sitting. The head is turned 45 degrees to the opposite side of the affected ear. The patient is laid on the side with the affected ear and the nose turned toward 45 degrees in the opposite direction. Move the patient over to the opposite side while maintaining neck orientation so that the patient is laid on the unaffected ear with the nose turned down 45 degrees. And lastly, the barbecue roll. Now, the reason why it's called the barbecue roll is we're actually going to move the patient 360 degrees. But this maneuver treats lateral semicircular canal BPPV. The patient is lying supine with the head tilted up 30 degrees, and then we're going to turn the patient so the affected ear is toward the floor. The head is turned 90 degrees, or as far as it'll turn in the opposite direction of the side being treated. And we continue in the same direction with the patient lying on their side and the head maintained at 90 degrees, or as far as it'll turn. You turn the patient on their stomach with their head tilted 30 degrees facing towards the floor. Then we keep on rotating around. The patient will continue rotating in the same direction, lying on their side, the head maintained at 90 degrees or as far as it'll turn. And lastly, we're returning to the starting position. So regarding pupil detection, calibration, and the vision denied solution, these topics are actually covered in separate videos. Regarding goggle placement, the goggles need to be on tight enough so that they don't move during the maneuver, so that you can continue to record the eye, but they don't have to be as tight as head impulse testing. The eye video recording, when you're thresholding the pupil here, you can choose pupil location or grayscale image, but it doesn't matter which one you choose because the eye video recording will always be in grayscale. And then the last thing, you have two options: head position feedback and synchronized room video. And the reason why head position feedback is bold is because that's probably the most useful of the two. And the head position feedback will guide you to make sure that you properly position the patient during the maneuvers. But the synchronized room video, if you decided you wanted to do something different, a different maneuver like Gaffoni or some of the other maneuvers out there, then you can set up your system to do that and use the synchronized room video to record the patient. The last two things, external monitor and presentation remote. I think the external monitor and the presentation remote are extremely helpful during repositioning of the patient. You want to stay close to your patient, obviously, as you're moving them through these repositioning treatments. The external monitor, if you click this button right down here that says external monitor, will actually allow you to move the eye as well as the real-time SPV number up on a separate monitor. So what would be nice is if you have your table, you have the laptop on one side, an external monitor on the opposite side, so therefore you will always see that patient's eye movement. You will always see the real-time SPV no matter which way you're facing as the clinician, so that you can monitor those two things and then know that once that nystagmus subsides, it's time then to move to the next position. The presentation remote allows you to start and stop without being right next to the computer. So you can easily start and stop the test with the Targus Logitech type of presentation remote. So again, everything is focused on staying close to your patient and making your workflow easier. So let's go into the software and look at the three selections. So over here in the left-hand side is your navigation panel, and when you want to do repositioning, you click repositioning here. And then you have CRT, laboratory, and barbecue roll. So, and you can choose whether you want to do these with vision or with vision denied. Now note that your patient came in for treatment and you need to calibrate that patient, then you would uncheck the vision denied, and you want to obviously do the calibration without the vision denied solution on. If you decide you want to do these treatments with vision denied, then you would check the vision denied box. So for the canalith repositioning treatment, you have leftward and rightward as options. Laboratory, same thing, leftward and rightward as options, so which direction you're going in. And barbecue roll, same thing, leftward and rightward options. So you want to instruct the patient so they know what to expect. And then, like I said, that we have a real-time SPV on the software, so that'll either show up on the external monitor or on the laptop next to the traces. So here you have the traces. The red is the horizontal eye position trace, purple is the vertical eye position trace, and then right here is your SPV number, and this will be going on as you're collecting. And so as you see that nystagmus subside, that's when you want to move to the next position. Any information about the SPV, the real-time SPV or the SPV algorithm, they're found in the reference manual in the appendices. So here, the first thing you want to do when using head position feedback is center the head, and that starts your 0 reference point. So if the patient is sitting, you just have them sit straight ahead, their chin aligned like with the placket of their shirt, and then you hit center. Or if they're supine and they have their head tilted 30 degrees to begin, then you hit the center button. So that's the beginning. And then the head position feedback guides you. So this is actually an example of CRT. So here you can see the first step was moving the head 45 degrees to the left. It's showing you which canals are being treated. And then when you move the head, this ball, this little blue ball, needs to be aligned with the stick. So that's position number 1. Then you bring the head back with the head hanging over the edge of the table. That's position number 2. Then over 90 degrees and over 90 degrees again. That's 3 and 4. But the head position feedback will guide you to make sure you're properly positioning the patient. And then the other nice thing is that when you play back the data, the head position feedback plays back with the eye video and the traces. So now we want to show you how the head position feedback works. So the first thing we want to show you is the canalith repositioning maneuver. So here you can see the patient is being positioned, heads turned 45 degrees, then they're laid back, then they're turned over 90 degrees, and then 90 degrees more, and then set up. The next one is liberatory. So here you can see the head is turned, the patient is laid to one side, and then they're brought all the way over to the other side. And the last one is the barbecue roll. So we're going to see that the patient is going to move in 90-degree increments each time. And you can see the steps on the head position feedback as well as in the video. So let's talk about data analysis. Now this is an example of, this is actually liberatory, and this patient is normal. They did not have any nystagmus. So, I mean, to be honest, you probably wouldn't see this in a real patient with BPPV, but in our office we don't have anybody with BPPV, but I wanted to show you how the data analysis works. So you have horizontal eye position trace and the vertical eye position trace. Down here is the head position feedback. So step one, they went to the left side and then back over to the right side. You have the eye video, and then you have the SPV graph. So let's look at playback. Okay, so here in the software we have this test. This is a liberatory right word, and we're going to play the full trace. So we're not going to play from cursor, we're going to play the full trace. So you're going to see the trace, the SPV graph, eye video, and the head position video all played back synchronously. So she's just looking straight ahead. Okay, we made the first position. So now you would record if there was any nystagmus and not move them until the nystagmus subside. Now we're going to move her head, and over she goes. We need to tell her to keep her eyes wide open, so if they start to close their eyes or start to look down, then you need to remind them keep their eyes wide open. So she's over on her side, and now we're going to bring her all the way back around, all the way around. Let the nose down and around. There we go. And measure if there's any nystagmus present, which there's not, because she did not have BPPV. But that gives you an idea of how the playback works with the trace, the SPV, the head position feedback, and the eye video. And now she's sitting back up. Okay. So let's talk about the info tab. The info tab tells you the test type. So in this example, it's a baratory right word vision denied. The operator, calibration, the test date and time, the elapsed time, the analysis begin time. So if you wanted to analyze only a section of the trace, then you could choose where to begin that analysis. And then the peak SPV, so how much degrees of nystagmus the person had in the horizontal trace and the vertical trace. And then if you want to look at an individual beat, how many degrees of nystagmus there was in it, what seconds. In the test list, it'll give you all the tests that you collected, so test date and time. And this is showing us barbecue roll, liberatory, CRT, whether they were collected with vision denied or not. So if they were not, then these would not be checked. And then you can make remarks. You can click on remarks and type in remarks. You can type here some remarks if you want to make remarks. If there was something unique about a particular test, you could then check in this box with that little exclamation point. Next thing is reanalysis. So you can reanalyze the data, and let's go back to software real quick. So if we go to reanalysis here, I can choose to analyze the full trace, which is what's done here. Or if I decided I wanted to analyze after this point, I would say analyze from cursor, and then it's going to give me only that information. So you can see, let's go back here. Everything that's grayed out was not analyzed. If I wanted to analyze the full trace, I would click full trace again. And then the last thing is if I wanted to delete a particular beat. So this is for horizontal or vertical. I need to make sure I check the right one. But if I decided that that's really nothing, you know, I can look at the eye video and see that's really nothing. I could say delete beat and delete that. Same thing here. I could delete this one if I wanted to. or I can restore them back. And then wherever the peak is, I can set the peak if I don't like where the software picked it, and I can restore where the software picked the peak. The other thing to note about repositioning is that you can actually print the whole entire trace for the whole entire repositioning maneuver in a report if you'd like to do so. So if you have patients in your database that have had the repositioning maneuver, you're going to see your patient's name and information, and then there's these icons. Well, this little icon with the guy with his head hanging over the edge is our positional icon. So if there's a positional test, whether it be dynamic positional or repositioning, there will be a check mark next to your patient in the patient's name in that column to say that yes, this one was performed, to say that you have some data saved that's a positional test. Now, let's say that one of those 3 positional tests is not the one that you use in your clinic and you want to do something different, like Gaffoni. You would go to Options and Test Options. You can choose whichever one you're not using, rename it to Gaffoni. Make sure you change this to synchronized room video, or however many minutes you want to test for, and then you're good to go and you can do the Gaffoni test. You're still going to have that drop down that says leftward and rightward. So repositioning interpretation. There's not a whole lot of interpretation here. Some patients are successfully treated after one maneuver is performed, and sometimes it takes a couple of repositioning treatments to treat a patient.